was at the Ministry of Foreign Affairs, I had very strong personal relationship with it as well, ambassador. And I hope I will have official and that cordial relationship with you. Thank you very much and welcome. We will now have statements by the first person to give us a statement. And I will allocate, by the powers conferred on me, 2 minutes for each statement, except the statement that has to be delivered by the ambassador and the Honorable Deputy Minister. So I will now call on Dr. Yebo Kabo to deliver a statement. She has been very instrumental, personally and officially working beyond our comfort zones to make sure that we have this project up and running. Thank you very much, Dr. Kabo. You have it.
Good morning, everyone. Thank you so much. Yes. Honorable Minister, Honorable Ambassador, our PS, CMO, distinguished guests, I want to thank you for being here. Thank you so much. Today, we are all here to commemorate the 1-year anniversary of the first outreach services by the mobile health clinic. Thank you. So with the help of this government, in collaboration with the People's Republic of China and our Honorable Minister and the Ministry, the People's Republic of China donated 4 buses to make sure that every Sierra Leonean, regardless of where they are, regardless of the language they speak, they get access, equal access to high quality, affordable health care. With these 4 buses, over 37,000 Sierra Leoneans receive free health care. Guys, I need you to clap. Free health care, right at their doorsteps. Free health care, right at their doorsteps. And this includes babies, newborn babies, as early as 2 days old, pregnant women, elderly, adults and young adults, everyone. This mobile clinic, we do more than just providing free health care. It is at the mobile clinic where the opportunity was given to us by our ministry to make sure that every patient is dignified at the highest level because they matter. Yes, the patient that we see might be the poorest, might be the poor among the poorest, but then we dignify every patient. And I just want you to know that the responses from the patients have been immense. And primarily, every one of them, 99% of them say this words. We came at the mobile clinic, we came to the mobile clinic, and we forgot that we were sick. And ladies and gentlemen, let me introduce you to a 6-year-old girl who just very recently was saved from amputation, all because of the mobile clinic. And in the upcoming documentary, you will get the opportunity to see all of this. The mobile clinic, what we do, the lives that we save, they are real. This girl today, she's back to school, all because the mobile clinic identified her in a remote village of McKinney, wherein she could barely walk. She could barely walk, and she had all these native apps around her legs. When we opened it, the worst of the worst ulcers that I've ever seen. You can even see the bone. This girl could not stand, could not walk. With the mobile clinic, we provided a very crucial emergency care. We stabilized this girl, and then our team funded her to come to Connaught Hospital, where she was admitted, and today, she's able to work, and she can go back to school. Ladies and gentlemen, let me introduce you to another 70-year-old man whom we met at Mafoki village in Port Loko, the very first day, August 1st of last year, the very first day of the mobile clinic outreach services. And this patient had no pulse. He was brought to the mobile clinic with no pulse. And with our team and emergency care, this old man had a pulse. And not only did he have a pulse, he's actually still alive. And you will all get to see, as we are very excited to see the upcoming documentary. But so, I want to thank everyone, all the leadership of the ministry, this government, the People's Republic of China, but more importantly, I want to thank my team, the A team, who work tirelessly, whose efforts makes my work look so effortless. Without you, it would not have been possible. But with you, you volunteer your services. The mobile clinic works up to 11:30 p.m. We started most times at 7 a.m. We will go on to work at 11:30 p.m. and we work under the worst conditions. We use bush toilets. You guys risk your life, leaving your family to go to the worst places. I want to thank you. You guys are incredible and we've saved so many lives. Thank you. Thank you to the government. Thank you to the leadership of the MOHS for giving me the opportunity to lead this team. It's probably the most rewarding thing that I've ever done. Yes, I know I left a 3-year-old in Canada before coming here. But every life that we have saved make me leaving my child. I know it's sad, but it's worthwhile. Because I know that my child is in Canada, he can get the care. But these kids need us. And I'm profoundly grateful for the opportunity to lead you guys as we continue to save lives. I look forward to what's to come. Thank you.
You ready? The documentary ready?
It's upcoming.
It's coming,
It's
okay,
actually
right now.
in process.
Okay, all right.
Within a week, it will be ready. Thank you.
I have nothing to say about the personality. All what you said is a reflection of herself. Thank you for the good work. Thank you for this risking everything, even your kid, and to come to Sierra Leone to save lives. That's what we do here at the Ministry of Health and Sanitation. We will now invite the Chief Medical Officer, and it's no other person than Dr. Sati to make a statement.
Thank you very much. And I want to take this opportunity to welcome everybody to this Ministry of Health, No More Sanitation. So, Mr. Chairman, the Senior Permanent Secretary of the Ministry of Health and Sanitation, the Honorable Deputy Minister of Health, and His Excellency, my friend, the Ambassador of China, colleagues in the Ministry of Health and Sanitation, good afternoon. The PS and Dr. Kabo have said a lot about our relationship and what the boss does, or the bosses do. But I want to reiterate that we are grateful to the People's Republic of China and through you, the ambassador, for doing this. We have seen the phenomenal thing that we are getting from the bosses. The bosses are giving us the opportunity to take quality health care to where we could not get there. People who may need to move distances before they even come to our peripheral health facilities, let alone the time to get to the hospital. But the need for these buses are very high. We've been battling to really maintain them, and we are committed as a nation and as a ministry to ensure. But then you've also never left us behind. You've always been around us to support us as what we are about to witness here today. That is a clear commitment of you being a sisterly country to our country, and we'll continue to really cherish that one. There's something specific about the buses that I want to bring on. If you look at the statistics of all our healthcare data, our health-seeking behavior, be it at facility level, even up to hospital level, our male attendance is exceptionally low. It is only in the buses that we've seen above 50% attendance. for males. This is telling us something. We know the role of males as far as Leone society is concerned. The heads of families and other things, the breadwinners. The bosses are helping us to save our breadwinners and thus giving a lifeline to our children. So that is important. It's bringing the equation and making it balanced. Because our men don't come to health facilities. But with the bosses, we are seeing more. And we are really seeing the hypertensives that could have got the heart attack being saved. We are seeing the diabetics that could have gone into coma being saved. So it is phenomenal. It's something we need to improve. So we are grateful for the support. And we are even thinking to expand the bosses in such a way that we will have stations in every district so that they will be going. Because to rotate 16 districts, you may only have it maybe once or twice a year. If you get it everywhere, it's possible you may get it 4 or 5 times a year. It is a passionate plea, and it is only birds of the same feather that we flock together. We know the Chinese are in partnership with us, so we can rhyme together. So it's a message for us. As you are supporting, let's envisage to see how we can expand on them. Thank you very much.
When the CMO speaks, nothing more will be said. But I always tell him that, CMO, do you know you are professionally serious? He's not the CMO that sits in his office. He's always everywhere. I said, I admire the energy you have. If I can have 1% of that energy you have, and the expertise you have, then it will be good for me. Thank you, Semo, for that very powerful statement. Before we come to the ambassador, can we please applaud him? Give him a standing ovation. Before I hand over to him, I will let you know publicly that it's good for us to give thanksgiving, even when we go to mosques, when we go to church. The importance of giving thanks cannot be underrated. We actually need to appreciate him. Let me also divulge that I'm a beneficiary. I just came back from China. It's good for you to go to China and see the phenomenal work they have done. Let me hear twice. And then you know you appreciate them better. With these few words, I have the privilege, honor, and delight to have the mic to the ambassador to make a statement.
And Honorable Deputy Minister of Health and Sanitation, Dr. Mustafa, and my dear colleagues from MOHS, all team members of the Hospitals on Wheels project, media friends, ladies and gentlemen, good afternoon. I'm very glad to be invited today to attend this ceremony to initiate a great new tour for the mobile medical clinics to travel to remote areas to provide outreach services. These mobile clinics are special gifts from the envoy of His Excellency President Xi Jinping when attended the inaugural ceremony of His Excellency President Julius Maada Bio in 2018. And in 2022, His Excellency President Bio officially launched the Hospitals on Wheels project based on these mobile clinics. Since then, with the strong leadership of MOHS, with the hard work of the operation team and local health departments, and with the close collaboration between our two countries. This project has been truly built into the flagship project of the countries. This project has been, I think, now is an important flagship project of MOHS, which vividly demonstrates that how far we can go, how much good we can do. His Excellency President Julius Maada Bio praised it as one of the best initiatives Sierra Leone ever had. I think this is very high comment about this project. I know these mobile clinics have traveled to 13 districts of Sierra Leone, served more than 37,000 people, detected a lot of severe patients, and saved a number of patients' lives, especially for vulnerable babies, pregnant women, elderly people who are hard to reach quality health care. These mobile clinics brought health to them and brought hope to them. Also, the buses supported the COVID-19 vaccination program. His Excellency First Lady Batam Bio's free sanitary pads program, along with many other health programs going on here. We are truly impressed by how the mobile clinics could be an innovative and efficient solution to healthcare accessibility problems when they are well integrated into the current health system. I think all these achievements deserve our cheers and plaudits. At the same time, we really know this project also faced some challenges. I met with Dr. Kabul last week, and we discussed the challenges and how to tackle these challenges. I expressed the commitment of my embassy, continuous support to this project. Last year, we sponsored $100,000 to support the running of this project. Today, I am proud to announce that we are providing another $20,000 to support the operation of the mobile clinics in the future. We will continue to offer technical support and invite the Chinese medical team to participate in the outreach tour. We will continue to work closely with the MOHS to try our best to expand the mobile clinic service. Let it bring health to more people in need. Ladies and gentlemen, health and medical cooperation are always the highlight of Chinese Sierra Leone. First of all, practical cooperation since the establishment of diplomatic ties 52 years ago. Sierra Leone is the only country to which China dispatched 3 medical and public health teams. This year marks the 50th anniversary of the dispatching of Chinese medical teams to Sierra Leone. In the last 5 decades, they have treated over 800,000 patients, performed more than 100,000 operations, and trained over 5,000 local medical staff. Shoulder by shoulder, we fight against Ebola, fight against COVID-19, fight against hepatitis, fight against cervical cancer and other diseases. All this help to improve the well-being of Sierra Leone people and help to create better conditions for social and economic development. These are the concrete action to realize our vision to build a community with a shared future for humanity. Today, the China-Sierra Leone relations face new opportunities. President Xi Jinping and President Julius Maada Bio reiterated their commitment to working closely to promote our mutual beneficial cooperation in all fields. I think our closer cooperation in health and medical sector, including the mobile clinics project, will consolidate the traditional friendship and help to achieve the 5 big game changers by His Excellency President Bill, especially the human capacity building. We trust our medical and health corporations will yield more fruitful results and benefit more Sierra Leone people in the future. Thank you. Thank you very much.
His Excellency the Ambassador, words cannot express how grateful we are to the People's Republic of China and the Chinese Embassy in Sierra Leone in particular. Thank you very much. Thank you. Thank you. We do appreciate it as a nation and as a ministry. We will now have the Deputy Minister to make a remark. Deputy Minister, you are welcome.
Thank you very much. Chairman, yes. Honorable Ambassador of China, Your Excellency, Ambassador of China, CMO, colleagues in the Ministry of Health, members of the Fourth Estate, distinguished guests, ladies and gentlemen. Good afternoon, all, and thank you all for being here as we celebrate, I would say, this partnership between the Republic of China and our country, Sierra Leone. His Excellency the Ambassador was right that the mobile clinic program has become one of the flagship projects in the Ministry of Health, and it demonstrates the ministry's and the government's commitment to providing universal health coverage for all people across the life stages. If you heard from the MS, Dr. Leone, this clinic has provided care for everyone. From pregnant women, children, adults, old people, everybody has benefited. Over almost 40,000 people and 1,500 pregnant women. This is remarkable. Dr. Cabo, we cannot thank you enough. You and your team for the sacrifices you are making for this to happen. Your Excellency, Ambassador, and I would like to express our deep appreciation on behalf of the Minister, who is unavoidably absent, Deputy One, and by extension, His Excellency, the President, for everything that you have done to make this mobile clinic a success, but also for your continued commitment to helping us tackle health problems in our nation. China's partnership was instrumental in our response to Ebola, COVID, the mobile health clinic now, and even the cervical cancer and response that we are developing. And we could not have done it without you. 50 years is not a joke. 50 years of partnership and your continued commitment to supporting us. We are very grateful, we are appreciative, and we really look forward to continue working together to provide quality, effective, and universal health services for the people of Sierra Leone. I think I would like to thank everybody who has contributed to make this mobile health clinic program a success, and also want to encourage us to continue working hard enough so that we develop on the gains that we have made. We expand the services like the CMO said, which is very much needed, so that our people will continue to benefit from this. On that note, let me thank all of you again, and look forward to continue celebrating the achievements of the mobile health clinic.
Minister, let me thank you for taking your time. I know by now you should have been at your hospital to do some service, but it shows how committed you are. Thank you for that transparent statement. Now we have Distinguished ladies and gentlemen, we have come to the utmost point of this meeting. We will now have the symbolic handing over of the 20,000 USD, as the Americans will call it. I will kindly ask His Excellency the Ambassador, People's Republic of China, to Australia, to respectfully deliver the symbolic document or check to the Deputy Minister of Tourism. Can we take photos, please? Thank you, thank you. Thank you. Can we sit back? We have the end of this meeting will be climaxed by the closing courtesy, and that will be from the Director of Hospital Services, Dr. Matthew Frank.
Good afternoon, all. Mr. Chairman, permit me to start on the existing protocols. First, I'd like to say many thanks to you for sharing this occasion successfully from my end. And to the ambassador, to the People's Republic of China, to Sierra Leone, I'd like to extend our thanks to you. This week alone, I heard over the television, you have awarded so many Sierra Leoneans to go and study in China, and those just this week, switch again to again, we are also demonstrating the coordination of services to far-reaching areas where we cannot do it normally by using the hospital on the way. And when I was reading about hospital on the way, China is one of the leading countries that is making use of it. Thank you very much, and we send our thanks to the people of China. To Madam Minister, thank you also for your great efforts. You have come and you have started demonstrating as a young lady that you are ready to take the mantle for the successful implementations of the minister and also the president by achieving the big fight. Thank you for that one. And the person who has been seeing things work for the hospital on the way, Dr. Yebu Kabu. Dr. Yebu Kabu is an epidemiologist. I met when I was asked to nominate somebody for the MS for hospital on the wheel. So 2 names were given to me. But I called her and spoke to her. And she promised that she would never let me down. And all the time when we meet, that is what she had said. I promise I will not let you down. I'm very much happy that we have never done it. Just on Wednesday, I was very happy when she told me that she has been able to get some funds for the extension of the services to the provinces for another 2 months. And so I said, what's happened? And she told me that she had got some money from the embassy, from the embassy of People's Republic of China. So I'm very happy. We are not letting that. Thank you very much. Continue with your work. And to all who are here, colleagues, Ministry of Health, officials, the media people, and all that people. Thank you very much for coming here to be with us to receive this 20,000. It might be small, but that can go a long way in seeing the people in the rural areas. So tomorrow, definitely, this one was due to have happened on Saturday, but now it's happening. So tomorrow, we will be able to go there. Thank you very much. Thank you.
His Excellency the Ambassador, distinguished ladies and gentlemen, we have come to a very peaceful, cordial end of this wonderful celebration. Thank you, all of you, and have a very pleasant afternoon. Thank you. Okay. And today is the 1st of August. September. Can we have a photo opportunity with the ambassador outside?